Hi, what's going on, guys? This is Kieran. I'm a physical therapist, and I'd like to welcome you, some for the first time, and welcome some of you back. This is our video for our Phase 1 rehab for individuals who have had ACL reconstructive surgery, meaning from day 1 after surgery to 2 weeks after. If you just recently had an ACL surgery, this is the video for you to help you on your road to recovery. I promise the pain will get better and we will get you back to your goals. Here's a few things to remember when participating in this video. The point of Phase 1 is to decrease the swelling, inflammation, and pain. We need to work on range of motion, but especially extension. The quicker we can attain full extension, meaning getting the knee all the way straight, the quicker we can get into more functional activities such as walking. Ideally, we want you to perform these exercises about 3 to 4 times a day. This will help with controlling those aforementioned impairments, the swelling, and the pain. Our goal is to also get the quad muscle back engaged and just to make things a little bit more comfortable. With some of the exercises, you're going to be in and out of a brace. So it's okay if you need to pause the video, either to get into the brace, to take the brace off, or even if you're just having pain. So if you're ready, let's get to it. It's going to be about 10 exercises that we're going to go, all of them for about 30 seconds. Do your best, and we'll get through this. The first motion is going to be just ankle pumps. So I'm going to pretend that my left leg is the one after surgery. You can lie in your bed, on the couch, or anything comfortable at this time. I understand getting up and down may be a little bit more difficult, so getting from the floor may not be the best option. So we're going to start with just pumping the foot up and down at a nice controlled rate. Movement of the ankles to help promote a little bit of circulation. If we have any swelling, this will help with moving that blood flow. The first exercise and the ones we're starting out with, you can be out of the brace, that's fine. In fact, I encourage you to go ahead and take the brace off and stay out of it. Good. So after the ankle pumps, we're going to rotate our ankles just in circles. So I'm going to start clockwise. Nice, slow, controlled rate. I'm holding onto the leg so that we're not rotating the whole leg and not having the knee come up. Again, we want to focus on extension, keeping that knee straight. And now let's go counterclockwise. You guys are doing great. Keep it up. Very good. So next from there, we're going to go into quad sets. With quad sets, we're trying to contract our quad. So we're going to imagine there's something underneath the knee, and we're going to push down by tightening and contracting the quad muscle. Let's hold for a couple seconds, and then relax. If you want to place something under the knee to help with that motion, that's fine. Place the hands or even a small towel roll. But again, we're squeezing, contracting the quad, and then relaxing. Great. So I'm going to grab the strap here. So if you can grab a towel, a pair of pants, or any item of clothing, we're going to wrap it just around the foot. We're going to keep the heel down and then slowly pull just to work on our knee bend. We'll hold for a couple seconds and then back down. So just like that. So 30 seconds that way. So we want the leg to stay as relaxed as possible, and we're just allowing the strap or the towel just to help assist with that motion. Again, the knee is staying, the heel is staying flat on the floor, the bed, whatever you decide to lie on, and we're allowing the arms just to work with that bending. Good, a few more. So we don't want to push the range of motion to the point where we're in severe pain. We want to go to, on a scale of 1 to 10, when 10 is severe pain, to about 2 to 3 out of 10. Outstanding. So now let's go ahead and put the brace back on. We're gonna do a couple exercises with the brace. If you need to pause the video, I'll be here when you guys come back. If you're good to go, let's keep going. So we have the brace on our leg. We'll be standing. And again, if you're in any standing position at this time of surgery, we want that brace to be locked and straight. So we have our brace locked. We're gonna shift weight just side to side. So 30 seconds again. Putting pressure onto the leg and then off. You control the pressure. We just want the quad muscle to start to contract and for your body to be able to start accepting a little bit of a load, a little bit of a weight. Great. Then from there, we're going to go into a heel raise. So feet closer together, up onto the toes, and then back down. If you need to move so that you're close to something you can hold on to just for balance, that's fine. We're just going through nice, slow, controlled motion. If the balance does feel a little bit off, that's fine. We're going to keep working on it. The ACL plays a big role in our body's awareness and proprioception, so that balance may be off. Great. So after the heel raises, we're going to come back down, still with the brace on. And then you're going to lie back on your back. And we're working on a straight leg raise. And so we're going to try to raise the leg up to even with the bent knee and then back down. For some of you, the quad, the muscle on the top of the thigh may be a little bit inhibited or not firing the way we want to. So again, if you want to use the strap again to help assist with that motion, that's fine. So it's just lifting up with there, then controlling it back down. Great. So after those 30 seconds, let's turn to your side. I'm going to turn this way just so I'm still facing the camera. So surgical leg's going to be on top, and then we're lifting straight up again towards the ceiling, then back down. We want to keep the foot flexed up towards the head so that we're maintaining a good contraction in the quad. And then nice and slow and controlled. This motion should be a little bit easier for you compared to lying on the back. We're allowing the hip to help us a little bit more, our gluteus medius muscle on the side of the hip, whereas when you're lying on your back, it's just more of the quad and the hip flexor. Very good. So we're going to go ahead and lie back on your back or sit up again. We'll take the brace off. Let me turn again. Great. So we got the brace off. We're going to go back to just our quad sets again. Try to make sure we get good quad control. Just pushing down. Great. And then the last one, we're going to use just a pillow or something to prop the foot up. If you need assistance with placing something under the leg, that's okay. Now we're just allowing the leg to relax, try to finish off with fully straightening the leg for 30 seconds. So letting gravity do our work. A lot of times after surgery, the knee wants to stay in a little bit of a bent position. So we're working to maintain just that full extension, fully keeping that leg propped out. Great. Guys are doing well, almost there. So you may feel a little pull in the back of the leg. That's normal. That's fine. Guys, hang in there. Outstanding. Congratulations, you guys survived. You made it through our first round of exercises through this first phase of ACL surgery. Again, once now that we're done, we can ice, and I encourage you to ice for about 10 to 15 minutes. And we want you to do these exercises about 3 to 4 times a day. So go ahead and log back on. We'll see you again soon during this next round. Take care. It gets better.
you.